be doing a head-to-toe assessment today on our patient Brittany. She has suffered a left temporal parietal lobe stroke, so she is aphasic, dysphagic, and is having difficulty with word recall. So she may not be able to respond appropriately based on her disease process. However, we're going to verify it's our right patient based on her armband. We'll verify that against her chart for 2 identifiers like her date of birth and her name. And then following that, we're going to be performing hand hygiene and then coming and approaching our patient to get permission to do the head-to-toe assessment. And we'll introduce ourselves. Hi, I'm Shauna. I'm going to be your nurse today. I'm going to be performing a head-to-toe assessment on you. So it's going to involve listening and a little bit of touching and palpating. Is that okay with you? Okay, so we've got permission. We're going to start by asking, do you have any pain? And the patient's shaking her head no. So we're going to move forward. We'll do her blood pressure, temperature, pulse, respiratory rate, and her oxygen saturations, which all prove to be normal. And then we're going to start our patient with their head to toe. So we'll start with her head. We're going to make sure we're feeling for any lumps, bumps, or bruises, that there's no issues with her scalp, that her skin is intact, then there's no concerns there. We're then going to be looking in her pupils as part of the neuro assessment to make sure that they're equal and reactive to light. We would use a pen light to be able to make sure her pupils dilate between 3 and 5 millimeters, and they do so as appropriately. We're also going to make sure her face is symmetrical, that there's no drooping, but because of her stroke, she may have some left-sided facial drooping, but with the mask on, it's hard to assess. And then moving forward, we're going to be checking for her artery pulse there. And we only do one side at a time, so we're going to make sure those are good, which they are. There's no distension of her jugular veins, which is good. Ears, eyes look well, and then her mouth, we're going to assess for any cyanosis, make sure that the mucous membranes are moist and pink. And then we're going to move on to our chest. We're going to make sure that the inspection of it, there's no bruising, no lumps, bumps. We're making sure that the chest is symmetrical, that there's no barreling of the chest, making sure that it's 2/3 to 1/3, and then we'll be able to auscultate for our lung sounds. And while we're here, we can also take a look at our heart sounds. We're going to start at the apex and listen for any wheezes, crackles, stridor, pleural friction rubs. And then we'll move down into the first intercostal space and listen to the right and left sides of the lung. And then moving our way down, sorry. I'm just going to move this out of the way. And then we're going to move down to the other side. And make sure we'll get the right lower lobe. Good. And so her lungs sound clear, no concerns. And then we'll take a listen to her heart tones. So we're going to start at the mitral valve, or the aortic valve, sorry. Move over to the pulmonic. And down we'll be listening to the tricuspid and Erb's point, and then the mitral valve. So we're listening for lub-dub sounds, that there's no murmurs or swooshing. And then we're going to listen at the apical heart rate for 1 minute. And her pulse was 86 beats per minute. So now, following that, we're going to make sure we inspect her upper extremities. So we're looking for her capillary refill, we're looking for any IV sites or any PICC lines, central lines, any dressing changes that might need to be done, making sure there's no skin tears, that she's got good peripheral vascular flow. Her capillary refill would be 2 seconds. So that's good. And then we'll go on to our abdomen. We're going to ensure that the patient doesn't have any large masses, any protrusions. If the patient has a G-tube, we would assess that, or an ostomy for stool output, color, and consistency. And then we would be able to move on to our auscultation. So we're going to start in the right lower quadrant and listen for any baborgamy. And then we'll move up, going clockwise, listening for any normal gastric sounds. And we'll end up in the left lower quadrant Good. So at this point, we're going to be able to palpate. We're going to start with a soft palpation. So you're just gently looking for any guarding that the patient might be having. This would be a good time to note any recent bowel movements, whether the patient is having constipation and what their bowel pattern looks like. And then you can do a deep palpation, looking and feeling for the liver and making sure that there's no pain and the patient is good in that area. Then we would move on to our lower. So while we're down at the lower end of the body, we're going to be assessing the patient's lower extremities. We're going to be looking for any edema, hair loss. We're going to be looking at their vascular scenario, just making sure they have good blood flow. We would be able to make sure we pay special note to the patient's heels and there's no skin breakdown or ulcer formation from being in bed. We're also going to make sure we assess the pulses in the dorsal aspect and also their femoral pulses as well bilaterally. And then we also want to make sure that the nails are in good shape, that they're trim and clean, and that we also have good capillary refill on both sides, and that again there's no edema. But you're just going to roll over all the way. There we go.
What?
All right, and then we're going to listen to our patient on their back. We're going to be assessing the spine and making sure that there's no skin breakdown on the back, especially paying close attention to the coccyx area. We're going to listen again to the breath sounds in the patient's back, starting at the top, listening between the scapula and the spine to make sure that we're not listening over bone. And you're going to crisscross your way down, ensuring you listen to all the lobes of the back. Good. All right. And now you can roll back over. And then another important area that you need to assess is the psychosocial aspect of the patient. So you're going to communicate with the patient as best you can. You may have to gather some data from the family or social work, and then just do your best to make sure that the patient's not struggling with any depression or any mental concerns regarding their recent stroke, and assessing how you will be able to effectively manage those. So that could include a variety of interprofessional team members. But I feel like we've now covered our head to toe assessment, and big thanks to my patient, Brittany.